Hello everyone, my name is Caitlin Reddy and I'm a student physical therapist. Today I will be discussing with you all a condition known as fibromyalgia. So let's jump right in. What is fibromyalgia? Fibromyalgia is a debilitating rheumatic condition brought about by unknown etiology. It affects 2 to 2.7% of the population and mostly affects middle-aged women. It comes at a ratio of 3 to 1, affecting more women than men. Symptoms for this condition can include chronic pain throughout the body, fatigue, disrupted sleep patterns, and pain and tenderness at specific points on the body. On the right, you will see an image showing the 18 specific tender points that are most symptomatic for fibromyalgia patients. It's 9 points bilaterally. They are on the front and the back of the body, with the most superior point being at the inferior portion of the occiput and the most inferior point being on the medial side of the knees. When diagnosing fibromyalgia, the tender point image was used in combination with taking patient history. If the patient had persistent and chronic pain for a minimum of 3 months, as well as tenderness at least 11 of the 18 specific tender points, then they were considered to have fibromyalgia. However, in an article written by Kwiatek in 2017, he discusses that these two components alone were not enough to diagnose the condition. He further discusses how a fibromyalgia survey questionnaire had been developed as a tool to use to further confirm the diagnosis. This questionnaire can be seen on the right side of the screen. Because symptoms vary from patient to patient, this tool gives the practitioner a standardized way to gather numeric scores to scale it. The results of the questionnaire can be scaled to compare against a threshold and used in combination with the clinician's diagnostic skills and knowledge. It helps to rule out other disorders that fully explain the symptoms. Several comorbidities exist amongst fibromyalgia patients. This can include anxiety and depression, irritable bowel syndrome, chronic fatigue, temporomandibular joint dysfunction, restless leg syndrome, and sleep apnea. It is important to screen for and treat these comorbidities if they are present, because these disorders can initiate and worsen fibromyalgia symptoms. If they go untreated, it can continue to exacerbate the pain, and fibromyalgia treatments alone will not be effective. On the right, you will be able to see a questionnaire that is used to screen for fibromyalgia and associated conditions. This screening tool is also presented on the next slide for better viewing abilities. Because fibromyalgia has been determined to be a chronic pain syndrome, several factors play a role in proper management. This includes patient education of the condition, setting realistic goals, and the use of both pharmacological and non-pharmacological treatments. Therapeutic exercise is just one of several non-pharmacological treatments for fibromyalgia patients, but literature has consistently found it to be effective. Despite the extensive research that has been done on this topic, an ideal exercise plan for management of fibromyalgia has yet to be determined. However, it has been shown that aerobic exercise, resistance training, stretching, and balance are all supported by research to be effective for fibromyalgia patients. When starting an exercise program, there are some risks and precautions that patients should be aware of. This can include not doing too much too fast. When patients begin an exercise program, they should start at low intensities and progress as the patient sees fit. In addition, overly vigorous exercise can cause patients to have flare-ups or increased pain, both of which would want to be avoided. Benefits for therapeutic exercise can include improvements in cardiovascular health, flexibility, strength, and balance. With improvements in these categories, it can lead to decreased comorbidities, which can then lead to an increased quality of life. Here is an example of an exercise program that would be suitable for a patient with fibromyalgia. In a systematic review done by Hauser et al., it discussed the positive benefits of aerobic exercise for fibromyalgia patients. Doing 20 to 30 minutes of low to moderate aerobic activity with intensity that allows for the patient to still be able to speak fluently with another person is ideal. This can be done 2 to 3 days a week. Patients should start at levels below their capability and then gradually increase it. In 2018, Assumpkow et al. Found exercise stretches and resistance training to both be effective treatments for fibromyalgia patients. Stretching can begin 2 to 3 days a week and can increase up to 7 days a week as long as the patient is tolerating it well. If range of motion is decreasing, the patient would want to lessen the frequency. Intensity should be a low load such that the stretch is felt but it does not inflict any pain. Stretches can be held for a static stretch for 20 to 30 seconds and done for 3 to 5 reps. Examples of stretches can include overhead tricep stretches, door frame bicep stretches, single leg stance for a quadricep stretch, where the patient can hold onto the counter for support if needed, or sitting in a chair with the knee extended and the foot dorsally flexed. The patient can lean forward to stretch the hamstring and the triceps surae. All stretches should be done bilaterally. Resistance exercises can be done 2 to 3 days a week on non-consecutive days. Exercises should be done at low intensity and should be self-perceived by the patient in order to avoid flare-ups. These can be done for 8 to 12 reps for 2 to 3 sets. A patient can use a TheraBand in order to do some of these exercises. They will likely start with yellow or red since they have the least amount of resistance. Exercises can include chest flies lying on the ground, tricep extensions, bicep curls, or lying hamstring curls. They can also do exercises without any resistance, including bridging, Supermans, body weight squats, starting with mini and then progressing to full, or some curl-ups. Lastly, a balancing exercise will be discussed. Balancing exercises can be done up to 7 days a week with a low intensity. First, you will want to have the patient starting in double limb support in order to ensure that they have stability. If they want to progress from there, they can either do the exercises with eyes closed or in single limb support. Patients can stand at the kitchen counter in case they need the counter for support. They can start doing single leg stance, holding the position for 10 seconds, and then switching legs. They will want to do 10 reps per leg and do that for 2 to 3 sets. Any of these exercises can easily be adapted to a home exercise program. It is not uncommon for pain and fatigue to occur, but it should be tolerable and return to baseline within a few weeks of consistent exercise. Exercise has been seen to be the most effective treatment for fibromyalgia patients, and therefore it is really important that they are choosing exercises that are enjoyable so they continue to participate in them regularly. Thank you all for watching. I hope you found this video informative and helpful.